Hi, my name is Chetan Mehta. I'm the founder of SkillCubator. We are a training and placement institute based out of USA and Canada. We recently hosted a webinar on healthcare business analyst in which we had a very engaging conversation and we had a Q&A round at the end. I thought of sharing those few questions which were asked during the webinar. I selected the most commonly asked questions. So let's begin. Question number 1. If someone is working in healthcare industry, is it possible for them to move into IT? So the answer is yes, absolutely yes. In fact, people who have never worked in healthcare, they can also switch into the healthcare IT domain, but I take this question as it was asked. So the answer is yes, people from the healthcare domain can successfully transition into IT. In fact, healthcare is one of the best feeder industries for the IT roles because of its complex systems, data, compliance, and the workflows. It creates a very niche segment in the IT domain. That means people who have a strong healthcare industry background are always in demand in the IT because not many have healthcare domain knowledge. See, healthcare professionals already understand the complex business processes on claims, billing, care coordination. They understand the critical systems like EHR, electronic health record, EMR, which is electronic medical record, lab systems, radiology systems. Apart from that, the compliance and the regulations like HIPAA, PHI, data privacy, accuracy, all of that. IT teams struggle without this domain knowledge. So that's when the healthcare professionals add immediate and immense value. Then we have question number 2, which is what type of healthcare professionals can transition into IT? Well, there are 6 roles in healthcare which can easily transition into IT. First, nurses and clinical staff. Second, medical coders and billers. Third, healthcare administrators. Fourth, medical records or HIM, which is healthcare information management professionals. Number 5, pharmacist, lab technicians. Number 6, insurance and claims specialist. Then comes question number 3. Can you please explain few of the roles in the healthcare domain that don't need any coding and can switch into IT? I'll start with healthcare business analyst. They are responsible and accountable to translate the clinical needs into IT requirements. They create the workflows, user stories, and documentation. Then comes clinical systems analyst. They support hospital systems and integrations. They train the users and troubleshoot any issues. Then comes healthcare data analyst. Very important. They work with the data. They analyze the patient operational data. They work with tools like Excel, SQL, Power BI, and Tableau. Then comes EMR, which is electronic medical record implementation consultant. They configure systems during hospital rollouts. And last but not the least, product owner SME. They represent clinical needs in agile teams, no coding required. Then comes question number 4, do any of these roles need coding? As I said, no coding involved, except for data analyst, you need to learn SQL, which is not a conventional programming language like Java or .NET. It's very easy to learn. In few data analyst roles, you might need Python, which is a programming language, but it is relatively easy to learn as compared to Java and .NET. But as I said, most of the data analyst roles, you may just need Excel, SQL, and any data visualization tools like Power BI or Tableau. But apart from that, it's also important you need to use your soft skills, like communication skills are very important. Then the next question is, can you please tell me how to transition into any of these roles? Well, it's very simple. First, you need to identify the transferable skills, whether you have worked with workflows, data, compliance, reporting, insurance, and billing. Second step is you need to pick the right role, whether it's a business analyst, data analyst, or any other roles which can fit your past work experience. And then of course you need to build a good resume, build your profile, and we need to start applying. Last question, what salary can we expect once they start their career in IT? Well, this is very subjective, but I will put this, this is very subjective, but I'll put this way. Any IT on the healthcare domain can easily expect a 6-figure salary. Now, this will depend on the type of project, the location, and any specific role you're working in, right? So that's a bit, subjective, but on an average, I will say roughly between 100 to 150K is a good range. I can easily say that any of these roles can earn it. So these were the most commonly asked questions during the webinar, and I wanted to share with all of you. If you think, you want to transition into IT with your medical or healthcare background, or even if you don't have, you want to transition into healthcare IT niche segment, please call us today on 703-200-9921 or 647-699-4001. We will chalk out a transition plan for you, and we will make sure that you seamlessly transition into healthcare domain, but more specifically into the healthcare IT segment. So please call us today if you want to transition, and we'll talk to you very soon. Thanks.